Hello again. My name is Leon Thomas, the host of Real Thoughts and Conversation. Thanks for being with us today. Real Thoughts and Conversation is a production of the Leon Thomas Group. To learn more about us, go to theleonthomasgroup.com. We have another great conversation today. Again, for our third episode, we're going to have Tonya Henry with us again today. Tonya, how you doing?
Doing pretty good. How is it going there?
Everything is groovy here in beautiful, beautiful Baltimore, Maryland. It's great to have you with us. And so, Tanya, this is the third time that you've been on our show. I think the third time in 2 or 3 weeks you've been on the show. Just
Yeah,
great feedback from folks that have watched the show, that are becoming interested in learning more about healthcare, but also particularly the illnesses that you have. So, could you take a minute or two and give us just a quick recap of the illnesses that you have, and then we'll go ahead and bring on some of the guests that you've been some of the folks that you've been working with to help get the information out about this. So go ahead, Tanya.
okay. I have autonomic dysfunction that includes things like hypotension, migraines, gastroparesis for me. I also have mast cell activation syndrome, which is sort of like I'm allergic to everything. I have Ehlers-Danlos, a connective tissue disease. I suffer from migraines. I have gastroparesis and primary immunodeficiency.
And we've been with all that. One of the things that everyone that's responded and that I was impressed with you about is that you're managing these things, all of these illnesses, and you're helping others learn more about these illnesses and providing you're a patient advocate. So
Yes,
again, just my hat off to you for having the great attitude toward that and being able to help others.
thank
And you have with us today, we have Wes Michael and Christine Zerkowski. Wes, good morning. How are you?
Good. How you doing? Hey, you said Baltimore. I live right outside of Baltimore, so we got a connection there.
Do you really? I live in near Towson. I'm not
That's
going to give.
that. You're my neighbor, buddy.
Come
So,
on! Oh man, we gotta get you on the racquetball court. I
oh,
run a racquetball program at
oh
the
my
Northeast
God.
Rec Center. We'll get you on the
All
racquetball
right.
court.
All right.
Tanya, Christine, thanks for joining us. This is a Leon and Wes show now. Thank you. And Wes, your organization is called Rare Patient Voice. Tell us some about that.
Sure. Yeah. What we are is we call ourselves a market research company. What we do is we give patients and caregivers, and when I say caregivers, I mean like family members, parents of kids with the disease, or spouses, that kind of thing. We give them a chance to share their opinions in studies, surveys, interviews, things like that, and then they get compensated for it. So people love to give their story, and they get $100 per hour too. So it's really been a win-win, and Tanya's been a great advocate for us.
Okay,
thank
great.
you.
Thank you. And Christine Zerkowski, you're not from Baltimore also, are you?
I am not. I am
Uh,
from Connecticut.
all right. And you're
Sorry,
the
just
vice president of community involvement for an organization called Health Union. Tell us about that.
Yes, I'm the vice president of community development for Health Union, and Health Union builds online communities for people living with chronic health conditions, and we serve both patients and caregivers. So similar to West, that could mean family members or others caring for those living with the conditions. And our model is based on providing social support for those living with these chronic conditions. And we know that the social support that we provide and that others can provide can actually positively impact the lives of those patients and caregivers. So that's a little bit about what we do.
Okay. Now, Tanya, tell me first. Let's start with your relationship with Christine. Tanya, how did you get in touch with Christine? How does that work?
Well, I actually was emailed from someone through another organization called We Go Health, which I believe is Health Union has taken over We Go Health. And We Go Health is another site for patient advocates. And at first, I was emailed to do a possible promotion about a migraine medicine, but I wasn't picked for that. So then I was emailed again and said, hey, I might have an opportunity for you. It's an ongoing thing. It's with migraine.com. You can write for them or help moderate. Is that something that you would want to do? So that's when I said yes. And then I was put in touch with the two people that maintain the migraine.com actual group. And I just recently met Christine, I think last week.
Okay. All right. And tell us about your relationship with Wes. How did you become involved with Rare Patient Voice, and how did you meet Wes?
I think I got involved with Rare Patient Voice. I think a friend actually sent me the link, and then I went on there, checked the site out, thought it was something that I would be interested in. And that was around 2019, I believe. And so I've done interviews, surveys, different other projects through that company as well. And I heard of Wes and I've seen videos that he's done, but I did not really get a chance to officially like have any discussions with him until, I contacted him about coming on the show.
Hmm. Now, Wes and Christine, we'll start with you first. Tell us how important it is to have a patient like Tonya who's willing to share information, willing to help others. Tell us the real value in having someone like that. Christine, you go first.
Well, I think like the biggest thing, honestly, is providing patients with the support that folks like Tonya provide by letting them know that they're not alone. So these communities that are built for those with chronic health conditions, a lot of the times folks are living with these conditions and feeling like no one really gets it. No one really understands what they're going through because in their day-to-day life, they may not come across other people who are living with these conditions. But then folks like Tonya who write for our site migraine.com share their personal experiences. And then others who are living with these conditions are able to read about her experiences and connect with her, even through conversations on our social platforms. And that, like our ultimate win in any of our communities is when our community members reach out and say, thank you so much for sharing your experience. I thought I was the only one. Because having that support system, it doesn't have to be a face-to-face relationship, can really make a huge difference for people.
Yeah, now I can only imagine that what you're talking about there, that you often think we're the only ones, right? I don't have any illnesses that are anywhere near what Tanya's going through. I have high blood pressure, high cholesterol, and I was looking at my medications, and I have to take 4 medications a day. And the last time I went to my primary physician, I said, "Look, I'm up to 4 medications a day. Man, that's a lot of meds. How do I manage this?" And he kind of looks at me and says, "You're not the only one that's going through this. I thought I was the only person, that had all of these things combined." And so when you think of Tonya, everything that you're going through, and there are still others that are going through this. And Christine, like you say, it's so easy to think that we're the only one, but then to have an online forum where it's easier to communicate, that's a big win. So hats off to your organization for being able to do that. Wes, tell us about the value of having Tonya as someone that you all communicate with.
Yeah, it's like when at the beginning of the show, Tonya was listing all the various conditions, and I remember when she signed up, and I said, "Oh, look at all these conditions." And when I first started the Rare Patient Voice, I guess I was a little naive. I thought, people have a condition. So many conditions go hand in hand with other ones, right? So many of these immunocompromised diseases, and so people have so many different things. So on the one hand, we're like, please tell us everything you have, because if we have a survey opportunity in some other condition you may have, please be eligible for it. So someone like Tonya, it's the good news and bad news. The bad news is who wants to have all these conditions? The only silver lining is, well, you qualify to explain, give your story to other people, and it can only help others. But because of you represent a lot of other people, right? And so when companies want to come out with a new treatment or improve a product or service, they need to hear directly from a patient. The other way Tonya is very helpful to us is she spreads the word. She's what we call a referral partner. So she's always spreading the word to other patients and caregivers. And that's the way it helps us to find more and more people and to keep things up to date, because you want newly diagnosed people. You don't want to just have the same old people that, you want all sorts of different opinions. So she's helps us on both areas, giving opinions and helping spread the word so that we find more people to give their opinions.
Mm-hmm. Now, Tonya, on your side, all of the work that you're doing here with migraines.com, the work that you're doing with Wes on surveys, when you were first diagnosed with these illnesses, was this something that you immediately thought, I'm going to get involved, or did it take some convincing or coaxing? Tell us about your journey through becoming involved as you are.
Well, I think it probably started because whenever I would go like to the emergency room and stuff, you don't think when you go in because you're sick that a doctor is going to ask you, well, what is that? I've never heard of that. Or what's a gastric stimulator? I've never seen one of those. And they actually have to research to find out about your condition to how to treat you. That's shocking. And so when I go into the emergency room and they don't know what I'm talking about, then I will give them a little bit of background information. And so I started with that. I started researching and finding things. And through researching, that's how I come across a lot of different advocacy sites and how to get involved. And so I like to share on my Facebook group and LinkedIn and different things about me. And whenever there's an advocacy month or awareness month, I'm all about posting more about my story. And, if you have these symptoms, talk to your doctor, because these are a lot of the symptoms that go along with this. And I've had friends from other states say, hey, I have a friend who was just diagnosed with this. Can you talk to them for me? And so I've been connected through people just from me sharing my information online.
It's interesting you talk about your friend who said, I think I have a very similar condition.
Mm-hmm.
After the second show we did, I think you had Dr. Schwartz on with us. Is that
Dr.
correct?
Schultz, yes.
Dr. Schultz was with us. And on YouTube, there were folks that made comments that thought that they were having very similar symptoms as you, and they were asking, how do I get in touch with the doctor? What do I do? And so that advocacy work that you're doing is definitely paying off. Wes, how do patients get involved in your surveys? Do they send an email to you, or do you have ways of attracting them through physicians? How do you get connected with patients?
Yeah, I mean, our first way that we've done it is going in person to patient events. Advocacy groups there'll be a walk for MS, there'll be a hemophilia conference, that kind of thing. And we love to go to those events, set up a table and talk to people, because we get to meet them. And just as important, they get to meet us, so that when they get an email from us, they'll say, oh, I remember those people. They're not just stalking me. They want to give me a chance. So we meet people there. Now with COVID, right? So much for in-person events. So, and hopefully things are starting to open up a little bit. But what we've done is work with advocacy groups. A lot of them, they'll help us reach patients. They'll put the word out. Patients like Tonya, that put the word out to other patients, have been very, very helpful, because one of the things that we've learned so much, patients know other patients. Just like Tonya said, online, the internet has been great for people. There'll be some people have closed Facebook groups for a certain condition, and they'll share information. So all these ways help people find us. And then again, I'm eager again to get back out, and there's nothing quite like seeing people in person. Now, you don't want to do it right, immunocompromised. It's not a great idea to be out there among everyone. But at some point, hopefully, we'll safely be out there and be able to meet in person.
Yeah. Christine, how do you go about finding patients? Tonya writes for migraines.com. Are there any other websites that your organization has, and how do you find patients?
Yes. So we actually have 40 online communities for those living with chronic health conditions. So there, migraine.com was our flagship community, and that launched back in 2010. But since then, we have added 39, additional communities to our family. And we find folks in a lot of different ways, but a lot of it is just looking online for people who are actually active in the space, doing what they're doing in other areas. Like they could be writing on their own blogs, they could be active in other Facebook groups, or they could be active on some of our existing communities and have already, shared their experiences with others. So, a lot of times we're not finding the people who I guess would be considered like the superstars or, those who are like already known faces in the space, but rather those who are, active, but also might be open to sharing their story on other platforms. So our model is really based on meeting people, where they are in their journey. And, when we reach out to them, it could be to write for our communities. It could be to moderate and, just engage with community members on our social and platforms and our condition-specific platforms. So we can find them in a lot of different ways. And we look for people who have a lot of different experiences to share so that we're, basically meeting the needs of the community as a whole. Some people are really looking for, disease-specific information or diagnosis information or treatment information, and others are just really looking to connect. So we want to make sure we have content and community members who are able to meet those needs for the different segments. So we find them in a lot of different places, but in person is actually not really part of our model, since we are a company that builds communities online.
Yeah. I was having a discussion with someone yesterday regarding depression, and his thought was that, and as we hear so often now, that we need to treat depression like it is a medical illness and not something that it should be a taboo, conversation on, right? And he said, we see all of these celebrities out there, now talking about it. We see sports figures talking about it, but we need to have regular people, men and women on the street, talking about their illnesses. That's where we begin to make progress. So Tonya, that's in essence is what you're doing in your involvement with Wes and Christine and their organizations. And again, it's just so awesome that you're doing these things. Now, Tonya, your relationship with the two organizations that are represented here today, tell us again what you do. I know that you do some writing and all. Tell us more about what you do with Wes's organization and with Christine's.
With Rare Patient Voice, I've done interviews in the past, for just different pharmaceutical companies. I've done telephone interviews. I have made videos discussing things that I think need to be changed with certain medicines or products. What can doctors do better to help us? I've done surveys on different conditions or different medicines also. For Health Union, Christine's group, I have done writing articles, which, I try to write articles every single month. I also moderate. I love to talk with the people online. Like she said, just connecting with people. A lot of people feel alone and they just want someone to be there to talk to them. So I talk to people. I give them helpful links to different resources out there or links to articles. If they're discussing something, then I'll say, hey, here's an article. This is more information about that topic. And that's pretty much it. I don't do the private messaging with people. Other people on the site do that. I just like to share information for those who were just diagnosed with migraine, and resources for other people who may be stuck in saying, no medicines are working for me. What else can I try? So I just help them try to find information that's helpful.
And I would also think that family members would want to be involved as well, particularly when a diagnosis is new. I know I've had some family members in the last 5 6 years that have been diagnosed with various conditions, and the first thing that everyone starts asking is, well, what's it about? What treatment do you have, and all that? So we all start researching. So it's not just the patient themselves, and so I would think that particularly on the sites from Health Union, that there are more than just patients going there. Christine, have y'all found that to be the case?
Oh, absolutely. There are
Oh,
communities that are, looking for information and looking for ways to support their loved ones, and it's more prevalent on some communities than others. We have one for folks living with Parkinson's disease and also Alzheimer's. And I think, those are two examples of communities where a lot of those visiting the sites and looking for support are actually family members or other folks caring for their loved ones who have those conditions. So providing resources that are tailored to those who are caregivers and not patients is really important too.
Right. Wes, with rare patient voice, I heard Tonya make a reference to there's some conversations that also take place with those in pharmaceuticals. Tell us about your relationship with them. How does that work?
sure. Yeah, it's there's a lot of different parties that can get involved in these things. So our clients, if you the people that we're working direct, people that interview and that write surveys and do that, they in turn they work for biotech companies and pharmaceutical companies and device companies and people like that. So for example, if I'm Merck or Pfizer, there's a big companies and there's so many small ones now working in rare disease and stuff. But if I'm somebody in one of those and I want to learn more about patients, I might work with a market research firm and they might design a study. Let's talk to 10 patients. Let's ask them this. Let's learn that. And then they go, this is great, but where are we going to find the people? Well, then that firm comes to us. So we kind of close the loop and say, hey, we'll put you in touch with people that are interested in sharing their opinions. They never get, I should point out, it's confidential. The end client doesn't get people's names and things like that. It's all, as you can understand, that's sensitive information. But they love to hear what they have to say. So it really helps because if you are a Pfizer or a Merck or whatever, you're making all these decisions, right, about new products and treatments. You better take the patient into account, right? You don't want to just make it based on, the MBAs in some ivory tower. You want to hear what the patients need and want. So it's so valuable to them. And it's the great thing is they've seen that over time. We keep seeing the demand grow and grow because they realize we can't make decisions that impact patients without hearing from the patients.
Mm-hmm, mm-hmm. And Tonya, you're one of those patients that's sharing your information, sharing your story, and you're helping others. You're helping others do it. And so Tonya, how much of your day is spent with this being an advocate?
Every day is different. Like last week, I actually had the opportunity to do a virtual Zoom speaking with members of Congress advocating for, just healthcare change, like different bills that are coming up, things that help the immunocompromised, things that deal with, increased COVID funding and stuff. So that was like an on and off all day event. But sometimes I'm only on the computer a couple hours at a time. Some days I don't do anything with that. But it just depends, when I'm writing articles, I spend a few hours writing the article. But on the computer, like on the migraine site, I'm not on there like 24/7. It may be an hour to two at a time, and that's it. And then I'm always checking the Rare Patient Voice. I get emails pretty much weekly about some kind of a survey. I actually just did one last week, but the surveys, I don't do surveys constantly because, like you said, they are specific to certain conditions. So you only get a survey when something comes up for a condition you have. And if you're a caregiver, you'll get a survey for you being a caregiver for someone with that disease. So they do surveys for caregivers too. They want to know the caregiver's point of view as well.
Mm-hmm. Okay. I hope this is news to those that are watching. I didn't know there were surveys for caregivers. I just thought that we were the caregivers and that is it, and learn to deal with it. I didn't know.
Care. They care about your opinion. It's a good thing.
Yeah, it is. It is really cool. Christine and Wes, there's so many things that you hear people say. I want to have a job. I want to have a career that I can help people, right? And so you take your typical doctor, nurse, teacher. I want to help. I want to be involved in the community or some other community work, but you are doing things that are helping people, and so you're involved in that group of I want to help, I care for people, and so that's really great of you to do that. How did both of you, real quick, tell me, how did you get into this type of work that's so impactful? Christine, you're first, please.
It's kind of like I guess a long story, so I'll try to keep it as concise as possible. But I was working in the medical communications industry, and our clients were pharmaceutical companies, and my tasks were aligned with writing content that aligned with their specific goals. And I just didn't feel fulfilled because I wasn't actually interacting with people who were living with the conditions, but just rather seeing it through the lens of the different pharmaceutical companies. So through connections that I had made through that work, I had been keeping my eye on Health Union since they launched in 2010. And when the opportunity to join in 2014 came, I jumped at it because I always felt like I wasn't quite fulfilled in my previous jobs. But then when given the opportunity to actually interact with people and make meaningful connections and building relationships with folks living with chronic health conditions, being able to provide resources and support, and having a positive impact on them, in turn made such a positive impact on my life. I can't imagine ever going back to something that wasn't this fulfilling, because it's just meeting folks living with chronic health conditions, and just the people at Health Union in general are just amazing human beings. And it's just, it's great to be a part of an organization that actually wants to do good.
Right on. Wes, tell us, how did you start in this?
So I used to do market research for products like Cheerios and in Baltimore connection, McCormick Spices. And then I got into the healthcare field and quickly learned that patients really were interested in telling the story, but it was difficult to find patients, especially patients with rare diseases. So it was in my mind for many years saying, boy, there's a way to find people and give people the opportunity to do it. So I finally did that. In 2013, I founded the company, and I didn't know how it would work or whatever. But hey, now we have 700 diseases, and we've done 6,000 studies, and we've paid patients over $8 million. So you never know. And so it's so good. It's a win. It's a win-win. So and something I never even thought of happened. So many patients that we met at these events became advocates for us to find other folks. And then some of them were looking for full-time jobs, and we saw they had a lot on the ball. A lot of our staff now came from these different disease communities. And so they see both, so how sympathetic can you be, right? You not only you're working on our side for projects, but you understand the patients, that how difficult it is and the issues that they run up against. So hadn't planned it. It just fell into place very nicely.
Yeah. And then you both get to meet Tonya, who herself is an advocate, and it's a win, big win for so many. Yeah. So Tonya, thank you again for connecting us with Wes and Christine. Thank you so much. And again, thank you for the work that you're doing. Tonya, you mentioned that you're involved in social media. Tell us, how can folks find you on social media?
Well, on Facebook, it's kind of hard on Facebook, but because I have my settings kind of set to private, only friends of friends can find me. Even in some of my medical groups, I've said certain things, and I've had a person say, "Hey, I tried to friend you, but it wouldn't let me." And then I'm like, well, send me a private message. And if they send me a private message, then I connect with them. But on Facebook, I'm Tonya Henry on Facebook.
Okay.
So they can send me a private message.
All right. Great. Thank you. You got your settings all set up there, right? You can't get into me. Yeah. That's really the way the experts tell us it should be anyway.
Right.
Yeah.
Wes, if folks want to find out more about Rare Patient Voice, how do they do it?
So two things I'd say. Rarepatientvoice.com. I know it's a lot, but it's those 3 words, rarepatientvoice.com. We put everything we can out there, try to answer everybody's questions. And then personally, LinkedIn is good. Wes Michael on LinkedIn. It's people find me all the time there.
All right. And Christine, what if someone wants to get learn more about Health Union? How do they do it?
You can check us out at Health Union, or it's health-union.com. And you can also find me on LinkedIn, just Christine Zurkowski. You can also email us at contact@health-union.com. That's a quick way to get an email to us and meet somebody at the company.
All right. Great. Thank you, Christine Zurkowski from Health Union. Thank you, Wes Michael with Rare Patient Voice, and Tonya Henry, patient advocate. Thank you. Thank you all for being here on this episode of Real Thoughts and Conversation. You're helping so many people, and I applaud you so much for the work that y'all are doing. Thanks for being here.
Thanks,
for having
Elon.
us.
Tonya.
And folks, thanks for watching another episode of Real Thoughts and Conversation. My name is Leon Thomas. Thanks for being here.
All right.